Neurology is involved in the study of the nervous system, which involves both the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system as well, which involves the nerves as they come into the arms, into the legs, and about specifically with disorders associated with those two systems. The most common conditions that neurologists treat, speaking specifically of the nervous system themselves, of the central nervous system, you're talking things like stroke, epilepsy. Sometimes you can have spinal cord disorders. Multiple sclerosis would involve the brain and the spinal cord as well. Headaches, obviously, involving the brain. And then when you come out to the peripheral nervous system, you're talking about things such as peripheral neuropathies or radiculopathies, which are pinched nerves that radiate from the neck or the low back into the arms or to the legs. So when the patients come to see us, I think their major concerns are what are causing the symptoms that they're experiencing, what's the underlying diagnosis, and what does that diagnosis mean? What exactly is happening in that case, in that disease process? What's the ultimate treatment options for the patient in order to help treat the diagnosis that we're talking about, and then ultimately what's the prognosis for the patient long term? Well, I think when you look at big changes within the last couple of years, I think the big things are, treatment options available for patients with multiple sclerosis. There are no treatment options available for patients with epilepsy. In addition to that, there's new diagnostic options as well. And I think the other thing that's new is the Mayo Health partnership as well. That kind of gives us backup in case we need another set of eyes, looking at the patient's case to make sure that we're on the right path for the appropriate diagnostics and treatment options as well. The kind of neat thing about our group is that we actually all trained together, did our residency program at UC. We often consult with each other on more difficult or complicated cases in order to make sure the patients are being diagnosed correctly and that they're getting the best treatment option that's available to them.